So we've talked about some things that are fairly common. This one is fortunately pretty uncommon, but bacterial meningitis is, the literature says you can see it in between 3 and 13% of the cases. Most of the time we're going to see it in neonates, and there are a lot of bacterial causes, but most of them are bacteria that are going to be in the environment. So the E. coli, Salmonella, all of the bugs that are in the environment where the foal's living. We do occasionally get bacterial meningitis in adults, but again, it's pretty rare. What's the pathophysiology? Well, a lot of times the bacteria that are in the environment, not only in the stall environment, but maybe they may colonize on the respiratory epithelium, so they'll be in the nasal passage of the foal. The bacteria then go from there, invade the blood vessels, and get into the endothelial cells. Once they've concentrated in the blood vessels near the brain, then they're going to have an ability to probably infect those cells that are right there, because generally we have a really good, the foal and all of us, very competent blood-brain barriers, so it's going to keep things that shouldn't be in that nervous system out. But occasionally, if there's enough bacteria there and those bacteria start producing things that are going to break down that natural barrier to keep bacteria out, once that's broken down, then the bacteria might move into there and cause meningitis. Other times you can get it from a hematogenous spread, and then occasionally you could even get it if a foal had a trauma, where you might get a direct abscess and then spread from sepsis. And believe it or not, in one adult, I see that where they had used an aggressive bit and had a hole in the mouth and had a direct response from there. What are the clinical signs? Well, once that blood-brain barrier is disrupted, it's going to be very difficult to sort this problem out from any other neonatal problem. So whether it looks like a hypoxia or infection, basically they're going to appear depressed. They're going to maybe be hyperreactive or very, very sensitive. They're going to be sometimes over-responsive on their reflexes. Other times they're going to be quite stuporous and somewhat under-responsive. But you can see a lot of different signs, but the most significant ones are generally some evidence of dementia along with some cranial nerve deficit. So like in this foal, you can see that the eyes are deviated dorsally, and so you can see that. What about how do we make this diagnosis? It's really tough. This is one where you can do cultures of the CSF, so because the foals are so obtunded, it's easy to collect the spinal fluid and then culture it. But as Dr. Schnoberg mentioned earlier, one of the other things that we might do are start looking for evidence of bacteria on some of these next generation sequence testings. If there's evidence of other signs that are ongoing, they may also help lead us to this, but probably the biggest thing is that abnormal neurologic exam and an abnormal spinal fluid. So you can see down here, the fluid may have evidence of discoloration. Is that me? May have evidence of discoloration and even appear somewhat cellular. Since we can't grow the bacteria out of there very well, what we can do is look at it under a Gram stain. So we might be able to take a look at that, and if there's evidence of bacteria there, then we can make, based on what I said earlier, you get the bugs that you're most likely to be the cause, and move forward with treatment in that direction. So what do we want to do? We want to sterilize the central nervous system, control the inflammation, and so keeping them somewhat cool might be a helpful thing, along with Banamine or other agents that are going to be anti-inflammatory. The best antimicrobials are going to be determined by what you see on that Gram stain. But if you don't see anything, then we'll usually use things like enrofloxacin or third-generation cephalosporins. These are all fairly expensive. Some of the more common ones, chloramphenicol, can be helpful. So you need something that's going to have a broad spectrum to take care of bacteria that are both gram-positive and gram-negative. In addition, you want to be very strong on the anti-inflammatories to lessen the damage that's happening in there. And so even though it's an infection, sometimes there's benefit from using corticosteroids. Not long-term, 1 or 2 doses might be the right thing to do. Beyond that, lots of supportive care, control the seizures, keep them in a safe, protected environment. You might sometimes give intranasal oxygen, so you may also be, we can't always tell it for sure it's a bacterial infection, you might be treating evidence of hypoxia as well. Prognosis, it's a tough one. So it's guarded to poor, even if you use the most aggressive treatment that you can. And the big thing is that sometimes, as it says here, you'll have the oddball that will come out with a residual neurologic problem, like the one on the leftist side there of the screen where it's got a head tilt. And other times, you'll have ones that come out fully resolved and are able to go on and get all the way back to normal. I probably went through that too fast, but I know Dr. Metcalf said I had to get mine 1 minute shorter. But I did have one thing that I want to add that goes with Dr. Riddle. I don't do reproduction at all, but when I was a resident, my mentor taught me, this is Dr. Bowles, someone who might have taught Dr. Embertson as well. We were there at Michigan State. He was a veterinary student, I was a resident, but Dr. Bowles taught me how to always get the proper sex of a foal, and that was you palpate the mare. He didn't even do ultrasound. And then he came out and told the owner whether it was a colt or a filly. So he said a colt. Then he would go to his book and he would write down filly. So then if it was a colt, the client said, you got that right. And if they said, no, you were wrong, it was a filly, no, you'd go to his book and he'd say, no, see right here, I wrote it in the book on that day.